Welcome to Repros Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, Repros. Welcome to our first episode in the Biden-Harris administration. What? We made it. I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I'm recording this on the Friday after the inauguration, also known as the anniversary of Roe v. Wade, which I guess I can't let that pass without remarking on it. You know, it's so important that we fight to keep Roe in place to make sure that abortion stays legal, but it is definitely not enough, right? Right now, as we have talked about many times over this podcast, it's clear that Roe v. Wade is not a lived reality on the ground for so many people who need access to abortion. So Roe is important and we need to fight to keep it, but it is not enough. It is definitely the floor, but we need to make sure that everyone who wants an abortion is able to get one, regardless of where they live, whether they can afford it. It's basic health care. We need to keep fighting for that right. That's one of the things I'm thinking about today. You know, there's been so much going on, right, with the Biden-Harris inauguration, so many tears that day. I don't know about y'all, but it really hit me in all the feels watching the first woman vice president get sworn in, the first Black South Asian vice president get sworn in. It just felt so good. So I can't wait to see what comes out of the Biden-Harris administration. You know, I know we're going to have to push them to get all we want, but it's going to be so much better already than what we had from the previous administration. So I can't wait to have more positive episodes to talk about good things that are happening, than instead of having to focus on all of the horrible things all the time. So I think that's going to be a great relief for, I'm sure, all of you. Let's see what else. Oh, so this past weekend, I decided to start tackling my New Year's resolution, which was to try to bake pastry. And y'all, I made pain au chocolat and they turned out amazing. I was terrified. I just, the idea of having to laminate the dough and get all the layers of the croissant, like, it just seemed really scary and really intimidating, and there was no way this was going to go well. But you know what? I was going to do it anyway, because you know what? It was still going to taste good even if it failed. But y'all, it turned out so gorgeous. I'll make sure we share a picture or a video or something on our socials so you can see it, because one, I'm so freaking proud of myself, but two, telling y'all that that's what I was going to do this year, made sure that I actually did it. So it's really nice to have this like accountability check on myself. So, I'd mentioned that pastry was going to be my New Year's resolution. So I was really excited to already have one checked off. I don't know what's next. So if anybody has any suggestions, let me know and we'll figure out what to tackle next. Also, our next episode is our 100th episode. Y'all, I cannot believe that is true. It feels like we just started doing this podcast / we've been doing it for so long. It's a combination of both. So our next episode was going to be episode 100. So we decided to do something fun, and we are going to be doing an Ask Me Anything episode. So if you have questions, Rachel has been posting on social media for you to submit your questions there. So you can find it on Repros Fight Back on Facebook and Twitter, or Repros FB on Instagram. She'll keep asking for questions for the next week or so, up until we record the episode. Also, feel free to email me your questions, Jenny@reprosfightback.com, and we will make sure to answer your questions for that episode. It should be a lot of fun, and it should be fun to see what y'all want to hear about. So I'm really excited to share with y'all this week's episode with Dr. Jamila Perritt with Physicians for Reproductive Health. We have a wonderful conversation talking all about medication abortion, the ways it has been restricted, and why it's more important now than ever to ensure that we get rid of these in-person requirements for obtaining medication abortion. During a pandemic, there is no reason for you to be going in person and putting your life at risk to access basic health care. So we have a long conversation about medication abortion and what the Biden administration can do to make it easier to access. So with that, I'm going to take you to my interview with Dr. Parrot. Hi, Dr. Parrot. Thank you so much for being here today.
Hello. Thank you so much for having me.
So before we get started, do you want to take a quick second and introduce yourself and include your pronouns?
Sure. My name is Dr. Jamila Perritt. I use she, her pronouns. I am a board certified OBGYN and family planning specialist and the president and CEO of Physicians for Reproductive Health. Physicians for Reproductive Health is a physician-led advocacy organization that advocates for the use of medicine and science to shape policies and procedures around access to comprehensive reproductive health care for all people.
Well, I am so excited to have you here today to talk about medication abortion. It has been in the news a lot lately with SCOTUS and some other things. But it seemed like a really good time to kind of do a deep dive into what it is and what are the restrictions we face around it, and then what do we want to see from the Biden administration. So I guess we'll start at the very beginning. And what is medication abortion?
Medication abortion is an extremely safe and effective option, first of all, for people that are seeking abortion in early pregnancy. And so there are two types of abortion: in clinic or suction abortion is sometimes called, and abortion with medication. So medication abortion uses two medicines, mifepristone and misoprostol, to end the pregnancy. The first medication, mifepristone, actually stops the pregnancy from growing or progressing. And the second medication, misoprostol, causes period-like cramps to help you pass the pregnancy.
Great. So it seems, it's very safe, very easy to use, but there are a lot of restrictions and kind of a path you have to navigate to be able to access medication abortion. Do you want to talk a little bit about what patients face when they're trying to access this care?
Absolutely. I want to start by saying that abortion care in the United States is highly restricted, period. So whether
Right.
we're talking about abortion with medication or clinic-based abortion, there are a lot of unnecessary restrictions that are placed on accessing that care just at baseline. And when we really think about it, it's such a critically important and timely procedure, right? Abortion care cannot be delayed because the pregnancy continues. And so these medically unnecessary restrictions on access to care really make it more complicated and more expensive for people that are seeking abortion services. So when we're thinking about abortion with medication more specifically, then a lot of it is going to be dependent to some extent on where you live and how easily you can access a clinic in general. Depending on the state you live in, you might be required to hear state mandated counseling that's really intentionally designed to try to convince you not to have an abortion. And that's true for in clinic surgical abortion or medication abortion. Some states require that you visit a clinic twice. Once to receive this counseling, and then again to receive and take the medication or to have the abortion that you've chosen. And some states even have a ban on accessing the services for abortion care using medication through telehealth, which we've really seen grown a lot in during the COVID pandemic. And so when we're thinking, though, about really the restrictions on medication abortion specifically, one of the largest restrictions we see come as a result of something called the REMS. And it's an FDA rule. It's called REM, stands for Risk Evaluation and Mitigation Strategies. And this is essentially just a drug safety program that's put in place and carried out through the Food and Drug Administration, the FDA. And it's designed to balance the risk and benefit of a medication and to support safe use. It's important to understand, though, only a few medications have these REMs attached, and they're typically really dangerous medications that need to be regulated. Medication abortion, the mifepristone specifically, that first medication in the group, is restricted as if it were a highly unsafe medication. And so, from a patient standpoint, that means you have to have visits in the health center to get this medication that's safe enough, honestly, to be obtained over the counter. You have to sign additional consent forms to get it. You have to have additional follow up. And so, it's a really highly regulated medication, even though all of the medicine and science says very clearly that it's safe and it's effective. So there are lots of barriers to be able to go in and obtain medication abortion from your healthcare provider, even though medication abortion is really safe.
Yeah, and I think it's also worth pointing out all of these restrictions kind of interact with each other, right? So if you have a waiting period, it might push you past the ability to use medication abortion, or you have to make 2 trips and all of a sudden you can't afford, to take this time off. And all of these restrictions are just such huge barriers for some people.
Absolutely. So, when we are talking about medication abortion specifically, it's approved for use up to 11 weeks of pregnancy in the United States. So, thinking about what that actually means, most people don't even realize that they've missed their period until they're at least 7 or 8 weeks out during their pregnancy. And then you need to find a provider that actually can prescribe medication abortion. If you're a doctor like me that provides abortion services, including medication abortion, you have to be registered with the drug company. You have to have the medication in your office, in your clinic, or in your health center in advance. You have to have all of the administrative supports to be able to have these additional consents, these barriers that are put in place to limit access to this medication. And so for some people, that means calling around to even find out whether or not there's a provider in their city or even their state that provides this care. Then you also have to figure out a way to get there. If it's not in the city or state where you live or work, then that means travel for a lot of people. That means time off work. Most people who have abortions already have at least one child. So then that means trying to find someone to take care of your kids in order to be able to get in. When you lay all of these barriers on top of a public health crisis, the COVID pandemic, then we know that that's even more of a chance that by the time you're actually able to jump through all of these hoops, you're out of the window for being able to get the medication abortion in the first place.
Yeah, I mean, that's a great point. Like, so how has this changed during the pandemic? Because now you're talking about risking exposure to COVID by having to go to a clinic.
Absolutely. So lots of clinics and health providers have really tried to rearrange their services to support access to care for folks who need abortions during this time, during this pandemic. We realize that the need for abortion care doesn't stop because we're in the midst of a COVID pandemic. But we're healthcare providers, so we want to make sure that patients are able to remain safe and accessing these services. So for some healthcare providers, that meant really shifting to be able to provide this through telehealth or telemedicine services, for example. And so we were really relieved to see the FDA lift the requirement on medication abortion administration during the pandemic that required in-person administration of the first medication for medication abortion. And that's also the reason why the Supreme Court decision reversing this process is really so harmful, because it ignores evidence, it ignores science and the safety of our communities, requiring people to leave their homes to travel when we know that that absolutely puts them at greater risk of contracting COVID-19 and becoming sick because of it, trying to access this safe and essential medical service.
Yeah, I just remember it being such a relief when there was the first decision to expand and allow people to access medication abortion via telehealth. And it's just it's so frustrating to see the Supreme Court go back on that to, again, make patients put their lives at risk to go and access basic health care.
Exactly. And it's not just frustrating. I mean, it's dangerous.
Yeah,
It's
absolutely.
dangerous, right? And so we know that it doesn't require in-person administration. You don't need to come in and travel to my office for me to hand you a pill for you to be able to take then and pass the pregnancy at home. There's nothing essential about coming in and having a face-to-face visit with a provider to be able to get this pill. A lot of these services and the support that goes along with them can be provided through telehealth services, keeping people safe and protected and allowing them to shelter in place in the midst of this pandemic. So the mandate that people then had to travel from their homes, sometimes into another state to be able to get care, really is a safety issue in the midst of a medical crisis.
And again, this goes back to like, what will this mean for patients? Because again, you're talking about so many of these states also have waiting periods. So you're not having to do it once, you're having to do it twice.
Exactly. What we know is that states that pass abortion bans or restrictions on abortion care, including those states, for example, that specifically carve out or exclude telemedicine use for abortion services, tend to have not just one of those laws on the books, but multiple laws. So the states that have restrictions on telehealth often have waiting periods and mandating all kinds of what we call trap laws, the targeted restriction of abortion provider laws. So all kind of laws that are just designed to not keep our patients safe, but specifically to eliminate access to abortion care, period.
So, this is like the ongoing conversation right now of who's going to be the most impacted, because we always see it's the same people who are suffering the heaviest burdens from laws like these.
Absolutely. And so it isn't hard to tell who's going to bear the brunt of these medically unnecessary and, medically unsafe restrictions on access to care. So that's going to be folks in communities that are already historically marginalized from care and have difficulty accessing healthcare more broadly and reproductive health care specifically. So we're talking about young people, for example. What does it mean to be a young person who needs to access reproductive health care or abortion care and are trying to obtain access to medication abortion to need to travel to be able to get that care? What does it mean for folks who have low incomes? And so these are folks that are often not qualified through these current mandates, don't fall underneath the sort of the umbrella of folks that can work from home, for example. So having to take time off work, having to raise the money for travel, in addition to finding money to cover this needed care. So folks with low incomes are going to be disproportionately impacted by these mandates. And then also communities of color. We know that communities of color are more likely to need access to abortion services, are less likely to have access to insurance coverage, for example, that covers abortion services. And so finances, again, are going to be disproportionately impacted for communities of color. And trying to be able to get this care just really adds on additional burdens to an already inequitable healthcare system.
And I think this just makes me think. So, we're having this conversation on January 22nd, which is the anniversary of Roe v. Wade, and the promise that Roe offered to people to be able to access safe legal abortion in the US, and how that was never been the reality for so many people. And I feel like that disparity has only gotten worse due to all of these restrictions.
I agree. I agree. Roe is of critical importance in making sure that we protect and uphold the legal right to access abortion is important. And it's also important that we understand that that is simply the floor. Legal access has never been enough to ensure care for those who need it most and are who are least likely to be able to get it. And so just because abortion is legal in Mississippi, for example, doesn't mean folks who are in rural communities who have difficulty traveling and accessing the one abortion clinic that's there are going to be able to access that care. So when we're talking about the anniversary of Roe and the importance of Roe, it's really important to me as an abortion provider that we repeat that that is the floor. Legality has never been enough to ensure care for those who need it. We know that folks with means will always and have always had access to abortion services. Prior to legalization in this country, these were folks who were able to travel. They were able to pay for it out of pocket. They were able to get this care without threat of prosecution or persecution, whether it was legal or not. And so for folks who don't have the same resources, then that inequity remains. And we see it magnified, just as you pointed out, in this current moment in time.
Yeah, it's a lot to think about. And mentioning Mississippi, that just makes me think that SCOTUS is conferencing supposedly again today on the Mississippi restrictions that would be a direct attack on Roe. And we will know whether they pick it up or not, or maybe not, because
Yes, and Mississippi isn't the only place. You
right.
know, we don't want to give the illusion that
Oh no.
Mississippi stands alone. They are one of many states in a race to the bottom here.
Yeah,
And
for
so
sure.
places like Arizona, Texas, Ohio, Pennsylvania, Virginia, where I'm licensed, has thankfully started to loosen some of these restrictions. But again, we have to understand that this is part of a strategic effort nationwide to eliminate access to abortion care. It's not specific to one governor or one place. This is part of a larger movement to eliminate and prevent folks who need access to abortion from getting it writ large.
Yeah, we're hopefully going to be turning a corner with the administration being able to make some changes, but so many of the fights need to happen at the state level and will be happening at the state level that it's still a long road to go, especially with the new makeup of the court system.
Exactly. I'm so glad that you brought that up in terms of the Biden Harris administration, because there are a number of things that they can and should immediately do that will help us push back the harm that's been caused. And this can be done, some of these things can really be done through administrative action. And so there is an opportunity for sure at the federal level to really enforce the laws and the legislation we know will help support access to care. And there's a lot of work to be done at the state level. So when we're thinking about access to this critical service, then we have to think about it as a both and. What can be done to push back and roll back the harms that have been caused by the previous administration in accessing comprehensive reproductive health care? And what can we continuously do at the state level to address these inequities as well?
Well, that's a perfect turn to what can the Biden Harris administration do?
I think it's been wonderful to see the President-elect Biden and this new administration to repeatedly say that they will address COVID-19 by following evidence and science. And so they really can start on day one by allowing folks who are eligible to receive the medication for medication abortion by mail during the public health emergency to do so, right? And so issuing this executive order that suspends the in person mandate is one really important way to start. And this will ensure that patients are no longer forced to risk needless exposure to COVID-19 as a condition of accessing this care. The other thing that we really need to push this administration to do is to initiate a comprehensive FDA review of current restrictions on mifepristone so that a person's access to care is based on the latest science and medical evidence and not on policy and politics of the way that it's currently been framed. Even after the public health emergency ends, we have an enormous amount of data in science that supports the safety and efficacy and effectiveness of mifepristone and misoprostol and its use for medication abortion. And so pushing the Food and Drug Administration to use the science and medical evidence to make their recommendations around restrictions is really critical that we do that. And that includes elimination of the REMS. We know that this medication is safe and does not need to be regulated in this way.
Yeah, takes me back to thinking of the fights over Plan B and moving it to like being over the counter and having to really push the FDA to make those changes.
Absolutely, absolutely. And that's critical.
Yeah, you're right. Like, I think that is such a huge change that the Biden administration could easily make. One, to do it during the pandemic to make sure that no one is putting their lives at risk to access basic health care. But two, to make sure that in the future we don't go back to having it restricted.
Absolutely, because even long before the pandemic, leading medical authorities, including the American College of OBGYNs and the American Medical Association, have been clear that the FDA's restrictions on medication abortion have no medical basis whatsoever. All they do is create barriers to time sensitive essential health care. And so it's really critical that we take this time to listen to medical experts who are very clear and supporting the science and saying that this is government mandated harm. That's really the beginning and end of it. The negative impact of the FDA's restrictions on mifepristone has always fallen hardest on communities that are already being disproportionately impacted by inequities in care. And so we know that these now during the pandemic, as you mentioned, these restrictions are even more burdensome in exposing the people that we care for to these needless visits to hospitals and health centers to be able to get this care when it can be obtained safely through mail order and through telemedicine services.
So you also mentioned that there are things states can do. Do you want to touch on what states can do?
Sure. I mean, we have wonderful organizations, community-based organizations, and organizers on the ground who have really been pushing back on these abortion bans and these restrictions at state levels. Even looking at the initial lawsuit that was led by the ACLU in support of organizations like Sister Song, and that came out and really were very clear about the disproportionate impact on communities at a state level. And so organizers who are out there really reaching out to legislators and saying, this is the harm that these restrictions are causing in our own community. And we demand that we have equitable access to the care that we legally deserve and have a right to. So organizing at the state level to push back on the narrative that abortion is unsafe or should be restricted. We know that that is simply not true at all. So states like Georgia, who really defeated that 6-week ban, for example, that was done because of a lot of organizers on the ground, led by primarily Black women. Who really came out and pushed the state to honor Roe in this way and not eliminate access to care.
So we always like to end by focusing on what can the audience do? So what steps can the audience take right now to make this a reality?
I think that there's a lot of work that can be done as an individual and as part of your organization. Certainly at the federal level, we should all be pushing and encouraging the Biden and Harris administration to take immediate administrative action to reverse the decision to mandate in-person dispensing of medication abortion. And so that's critical. We also need to demand an end to the discriminatory policies that eliminate access and coverage for insurance coverage of abortion specifically for some communities. And I'm thinking specifically about bans through the insurance exchange and also the Hyde Amendment, which eliminates access to abortion care for those who are reliant on governmental insurance. And so pushing at the federal level is an important place to start. And then we also need to make demands, as we mentioned, at the state level and to say, we are your constituents. We live here and we demand access to these services. I think we often forget that legislators work for us. They're supposed to be representing us as their constituents and as people who live in the communities. And so we must make our voices heard and say that we disagree with these policies and we demand equal access to this care. And so those are really some important ways to lift it up. And then I would suggest that we, folks also partner with reproductive health organizations in their own communities that are already doing this work. And so there are many organized efforts across the country to make sure that folks who need it have access to abortion more broadly, and of course, medication abortion specifically.
Well, Dr. Parrott, thank you so much for being here. As always, it was a real pleasure to talk to you.
It's always my pleasure to talk with you all as well. And thank you so much for having me.
Okay, y'all, I hope you enjoyed my conversation with Dr. Parrott. I can't wait for next week's episode. I think an Ask Me Anything is going to be so much fun. So don't forget to send in your questions, whether on social or via email, and I will see you all in 2 weeks. For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at Repros Fight Back and on Instagram at ReprosFB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.